evening. You're with the Urban Debate here. Thanks for being with us tonight. I'm Sahar Zaman. And what me and my team has decided to discuss on this very crucial show here being a topic which requires much attention but is not being spoken about as much. This is regarding COVID cases that are now being reported on a far higher rate in the second wave of what we've noticed across India. Could this be a silent wave within the larger second wave that the country is witnessing? Now, there are so many parents here who are concerned about how to deal with it because there is, of course, no vaccine for children. They need to be administered a very different set of medicines if they are found COVID-19 positive here. And so far, we've had only one single protocol that has been released by the central government. This is, of course, in being able to identify the grade of COVID-19 or what could be seen in your child. This could be with respect to mild symptoms, moderate symptoms, severe symptoms, and what to do about it. But it's not just about knowing what to do about it. It's also about what is the available pediatric health infrastructure in the country. Can it take the load of the increase in the number of COVID cases that we're seeing in our children? Let's play out some figures, though, that we have. Very little of what has already not been scrutinized here, but these are the available figures. Let's play that up here, up on our screens, of what has been released by the Health Ministry. Now, as we read out these numbers, it's also important to note here that these are figures that have been reported COVID-19 positive cases amongst children in only the 5 worst affected states. And this has been for a duration of the 1st of March up to the 4th of April this year. We've already hit the month of May, and there is a possibility that these numbers could have increased already. But let's go state by state here. I'm going to be reading some of those numbers here and explaining to you the breakdown of the age group within children. I'm starting with Chhattisgarh. We first start with age 0 to 5, 922 cases reported. Age 6 to 10, 1,374. And then there is age 11 to 17 with 3,644 cases reported. Total cases reported in Chhattisgarh, 5,940. Let's play out the Delhi figures here. Total cases, there is of course a breakdown of the age group that I mentioned, but the total cases in Delhi reported 2,733. Maharashtra, which has been worst affected across the board, also holds the largest number of cases reported in children as compared to across the country here. This is a total of 60,684. Uttar Pradesh, they're reporting 3,004. And we still need to get in more figures. The ministry needs to release more figures here as well. The grand total of these figures has worked out to be more than 79,000. So there is a lot more attention that needs to be paid to this. Let's juxtapose this information here with respect to shortage of pediatricians across India. And the crunch is huge. Arunachal Pradesh has a shortfall of 100%. So this would literally mean that there is no pediatric expert specialty hospital or childcare center available. Assam has a shortfall of 76%. From the worst affected list that we read out, Uttar Pradesh, which has a shortfall of 77%. Rajasthan having a shortfall of 80%. And there are other states that are listed here on this as well. So our concern tonight is not just informing parents of how to understand and detect symptoms, how to deal with it, but also what kind of health care that can be available. How prepared are we for the wave within children COVID-19 cases here as well? Let's in fact throw this open here to our experts. We're going to be having a very, very informed decision about this. We have only experts with us tonight to address all concerns that parents have been raising on this issue. We have Dr. Vinky Rugwani, who's the pediatrician and vice president of the Maharashtra Medical Council. Dr. Rajeev Seth with us here as well, pediatrician and medical director of the Child Health and Developmental Center in New Delhi. Dr. Prashant Kumar, who is the consultant pediatrician at Cloud9 Hospitals in Bengaluru. We also have Dr. Nameet Jerat, who is the Senior Consultant, Pediatric Critical Care at the Indraprastha Apollo Hospital here in New Delhi, and Dr. Rahul Nagpal, who's the Director of Pediatric and Neonatology at the Fortis Hospital. We appreciate all the doctors who've decided to be with us tonight for this discussion here, and more importantly, in informing parents in what they need to know. Let's first start with Dr. Rajeev Seth here. Dr. Seth, this is something which is, as we said at the start of the show here, not being spoken about as much, but it is also which is showing a consistent increase in the second wave. What is it that we need to bear in mind for our children as we move ahead in this crisis?
Yeah, this is a extremely important public health concern, a problem that we need to now quickly highlight and address it, prevent, promote, respond, because children comprise almost 39% of our population. We have 440 million children in our country, less than 18. We have children who are also from very vulnerable and marginalized places. Parents who have been affected badly, who either they are themselves sick or they've lost their jobs or livelihood. 38 or 40% of our patient population in the most vulnerable districts and locations. You've already, your channel has already done some research on the COVID positive cases, but then there are a large number of children who are not tested. Mm-hmm. And the reason these children are not tested is many children are asymptomatic. They either have mild fever or cold, or it subsides on its own, and many times they are not tested. We have known right from the first wave that the COVID was affecting children. We believe even at that time they were super spreaders of the disease, but they were not severely affected. Mm-hmm. But in the second wave, as pediatricians, we are seeing a larger number of child population being affected. And we also know that 1 to 2% could have very severe COVID manifestation, which we call as MICS or multisystemic inflammatory disease, in which a Kawasaki disease, a illness which we have known as causing systemic vasculitis or blood vessel inflammation is happening in children. And so we need to be prepared for those worst cases of 1 to 2%. So yes, the second wave, you're absolutely right, that in second wave, we have many more children getting affected, and this problem is likely to go, and it can increase as well. And the worst part is that we don't have vaccinations for children. So here you have the large population of children, many in marginalized locations, many having disease. There's also ICMR data in the first wave, which says that about 7 to 8% cases were in children out there at that point. But if you take and extrapolate the number of children that we have, we don't have much more data in the second wave right now. But we in clinical practice, pediatricians would know that we have a huge amount of calls coming in with children with COVID disease. So it is an extremely important. Thank you very much for flagging this. Absolutely. And thank you very much for inviting me and others for this show. That's right.
No, absolutely. We would like to hear much more from you in this present hour while we discuss this more in detail. Let's also play out the set of protocols that was just last week released by the government of India. The attempt here is, of course, to make it fairly simple for everyone, to not raise the alarm, to not get anyone too tensed, but it's also important to be realistic about what we are staring at. But these are the set of protocols. In case of asymptomatic cases here, and asymptomatic cases, there's no way of detecting them. They're usually detected if they're living in homes who have COVID positive adults or parents who have been reported COVID positive. So in case of asymptomatic patients, children patients here, the brief here in this protocol, making it very clear that there is no special treatment needed. Just keep monitoring the symptoms if at all they intensify in the coming next days. If there are mild symptoms here, once again, they can be managed at home. What is required is isolation. But children who have comorbid issues here should be more attention that needs to be paid to them. Medicine could be a basic paracetamol, throat soothing agents that could be given here. Antibiotics, of course, are not advised. Moderate symptoms here, then you need to get them admitted in a dedicated COVID care center. Now, it's important here, if you get into a dedicated COVID care center, right now across the country, we only have adult COVID care centers. We do not have any functional children specialized COVID care centers unless you're taking your child, unless you're taking the child to pediatrics hospital here. Amoxicillin that can be given as well if there is suspicion of bacterial infection. If the symptoms are severe, which is the next stage here, most certainly needs to be admitted, assessed for organ failure, blood count that needs to be checked. Remdesivir, which is a very strong medicine, but that has been mentioned in this protocol. Remdesivir could be used in a very restricted manner. Dr. Prashant Kumar, how helpful are these set of protocols? What more would you like to add to parents listening right now who would still have many doubts? Dr.
Yeah,
Prashant
thanks for
Kumar, is my
having me
voice
here.
going through, please?
Yes. Am I audible now?
Yes.
Yeah.
Yes, please go ahead.
Yeah. Yeah. Thanks for having me here. So, like in the beginning, rightly said, you have highlighted very important because first of all, there are so many myths like, kids will not get affected, kind of immune to this disease, they will not get affected and all. So it's very important to highlight here that kids are not immune to the disease. Yes, they may be less likely to have a severe disease, but yes, they're not immune to the disease. So like Dr. Rajeev sir was explaining, he was explaining very briefly, very valid points. They are super spreaders. From that, I am positive, my wife is positive, my kid, I want to send it to my grandparents. That I always discourage because you never know whether child is going to give it to the grandparents. So always make it a point. Child, don't take it granted that that have the disease, they are immune to the disease. So testing them is very important. Now coming to the points that whatever medicines we are telling everything, I'm sure all the expertise will agree with me. We are all extrapolating the data from the adults. So if you ask every pediatrician across the country, none of us know the efficacy of these medicines, the outcomes of these medicines. Probably with the time we'll learn more and more, but at this point we have no other option. So basically like Dr. Rajeev was highlighting, probably 90% of them doesn't need any treatment, any specific treatment, I mean. So you need to know which babies need treatment of the treatment. It's not like every child, the moment they get diagnosed to COVID, you have to rush to the lab, do n number of tests, do CT scan, this, that, HRCT, give all possible, giving the steroids, this, that. All those things, like we were discussing earlier, more than 90% of the kids doesn't need any of these things. When I tell to parents, they get say like, I got positive, I got underwent HRCT, why are you not suggesting a CT for my child? Yes, so like all of us know, 90% of the kids doesn't need, but we need to understand the warning symptoms. What are the things when child needs to be treated? So all these medicines, in a nutshell, we really don't know how effective they are. So even the guidelines which are released by the government, which are adopted by Indian Academy of Pediatrician and all, yes, everything in all the guidelines, they have included remdesivir. If you put across like, what is the data we have, whether it is a safety or the outcome, probably we don't have much. But the option is, do we have anything else? Absolutely no. So in the phase of viremia, definitely it has been proven to be beneficial in adult trials. So let's extrapolate that to the kids. Hope most of the kids doesn't need this, but in kids who require this, definitely we should go ahead with that. But like we were discussing earlier, so it is basically down to controlling the fever, timing the disease, and watching out when exactly child needs to be taken to the hospital.
Dr. Nameed Jerat here, to what extent is this manageable at home? Because we've, of course, each one of us, all of us, have been so involved in this crisis for the past 1 year and few months. We're still coming to terms with what exactly are the symptoms in adults, what are the newer symptoms in adults, how the virus is attacking the body differently. It's a very, very early stage of study for children, much more early than what we've studied in adults. Could you reiterate certain warning signs? Because it's not just about allaying fears that most of this is manageable at home, but there have to be certain markers as well which indicate to parents here that now is the time to take them to a pediatric center, to take them to a doctor, and not manage this at home.
Right. I sort of agree with this statement, but again, most of the patients with COVID disease, be it adults or children, can actually be managed at home. You just have to be aware of what all to be looking out for, or as you said, the danger signs. So again, most of the children, and when I say most, I mean almost 85–90% of the children can easily be managed at home. All they need is the control of fever, good hydration, and someone to take care of them. It is a good idea to involve a pediatrician probably early on. And you don't really have to physically take your child to a pediatrician. With the advent of technology and online consults possible, it's probably better to get an online consult so that a pediatrician is aware of the condition, so you can track on with the pediatrician. A few things which you absolutely need to be watching out for is the child feeding well? So an infant, especially if the child is happy, feeding well, passing enough urine, most of the times, almost 99% of the scenarios, you are in a right place and you don't need to worry. So if the child is feeding well, does not have high-grade fevers, and does not have trouble breathing, then if these three conditions are met, then you are safe at home. Or to put it another way, if you have high-grade fevers in the child, and if the child is not feeding well, or the child has breathlessness, these are good warning signs for you to be alert and take your child to an expert pediatrician or a healthcare center for further evaluation.
Dr. Rahul Nagpal, how easy is home isolation possible and manageable for children who are that young?
Sometimes home isolation is actually the cornerstone of our management in any COVID child. It is very difficult for many parents who are themselves negative and to isolate their child. It becomes very difficult and they ask us, what should we do? We have a joint family, or we are living in one-bedroom flat, two-bedroom flat, and we are negative and there is no other way. The first thing is, don't send your child away to your grandparents, to other family members, because you will transmit the infection. The same principles are there in children. Please wear mask, keep a safe distance, put your hygiene as important, keep washing your hands. And if your child is old enough, educate your child. If a child knows something, that is very important. If he is educated, he will do whatever you tell him so. And please remember, parents have to be role models for their children. First, protect yourself. Your child will protect himself. If you are careless, if you are moving around without the mask, you can't force a mask on a child. So please protect yourself, and then you will be able to protect your children. Isolation sometimes is difficult, but with proper precautions, it is possible.
Yes. Absolutely. It's about keeping patience here. Isolation is difficult and stressful for children. Yes, please go ahead.
So I just wanted to add to all my colleagues, we are talking about physical health of the child. Our mental health is so much important. Children are cooped up in their own houses or in a single room. They are unable to go out. They have no friends to talk to. There is nothing which is entertaining for them except for watching TV, which we keep telling them don't watch so much TV, don't have screen time. At the same time, they have their online classes. There's hardly any exercise, no fresh air. So, and they are cooped up, particularly adolescents. I see so many adolescents and young children coming with stress disorders. Their mental health is affected. They are frustrated. In fact, today only I was talking to a 16-year-old child, and he was saying that I get palpitations when I get up. I'm pretty sure that there's nothing wrong with him. He is quite okay, but the anxiety is killing him. So mental health and keeping your children occupied.
Yes, and these are, of course,
it's so much important.
absolutely. These are impressionable minds, impressionable years here. Right now, we're still only talking about physical health. Mental health being a whole different aspect to this crisis, both for adults and much more for children here as well. Dr. Vinky, in your view, this is specifically speaking with respect to the role that you play for the Maharashtra Medical Council here as well. Maharashtra so far is that standalone single state which has indicated children COVID cases as a category as well, saying that they are in the process, at least the BMC in Mumbai is in the process of setting up child COVID care centers, which is not just going to take into account treatment for COVID, but also child care centers, a creche within that center here as well, children who are suffering from two positive parents here and their primary caregivers are not available. What has been the calculations that have been made in Maharashtra, of course being the worst affected, 60,000 cases that were reported in the last month. The calculation here that the third wave, they're already hit much more in percentage in the second wave compared to the first. And if there is a third wave here, they would be hit much more. So let's get ready with that infrastructure.
Yes. Now, if we see, we were discussing about the isolation. I'll just put one remark about isolation. The isolation should be a reverse isolation. I would like to say that those who are like grandparents or elderly should be kept isolated, because parents cannot be isolated from the child. So child and the parents is very difficult to keep them away, because small children cannot. So we need to keep a reverse isolation. That means the grandparents needs to be kept isolated. Now, coming to the point that you have raised about the large number of cases in Maharashtra and especially the children. Really, it's a very troublesome situation, I can say, in the Maharashtra that we have gone through in last almost 2 months or 1.5 months, and so almost 60,000 cases we could see in the Maharashtra state. And we, as mentioned by Dr. Rajeev in the beginning itself, that children are almost from 0 to 18 years, if we see, it is almost 40% of the population is a child population. So we can very easily say that now that because we are witnessing from the first, there is what differences we have seen from the first wave. Now in this wave, we are getting so many children who are actually getting infected. Now the children are actually the victims because they are not going to the school. We have seen that schools are almost closed since last 2-3 months, but still they are getting infected. It is all because we know that the spreadability of this virus, which has come in the Maharashtra, a double mutant virus, which has evolved, which was actually originated from this state of Maharashtra, is got more spreadability, more transmission. So one person is if there are 10 people in the house, in the joint family, in the first wave, we used to see that the 3 are getting infected, and other 6 were spared. But now in this way, what we are saying is, if one is infected, is infecting to 6 people, and only 3 are spared. So children, actually, pediatric population are actually the victims now we are getting. And because the Maharashtra government has to take some very, very quick steps to curb this, because now we are, since last 2 days, we are just seeing that the number has gone down slightly. As far as the Maharashtra is concerned, we can see the cases are coming slightly. A plateau can be seen at the Mumbai, Pune, and Nasik region, or in Nagpur also. But it is very, we have to be very concerned about the population in Maharashtra, and especially children who have been infected since so long. So, of course, the special vaccination is a very, very important thing which needs to be taken into consideration for that.
Yes.
All right. Since you've mentioned vaccination, the next step I wanted to talk about infrastructure, but I'll keep that on hold for a few minutes. Dr. Rajeev Seth here, the importance of having a vaccination for children. We're of course here staring into a vaccination shortage even for 18 plus, but the need to have a vaccine for children as well, that is something that is being addressed across the world with other pharma companies, other brands here as well. How soon should we be looking at this right now?
Okay, vaccinations, the most important thing. Right now, the trials have only been successfully done by Pfizer, and I think Moderna has also shown that for teenagers between 12 to 15, their vaccine is safe. These trials are ongoing, and I don't see that we'll have a vaccine before the end of this year. And therefore, this is a very, very important time for us. When we don't have preventive vaccinations for, say, this entire year, what you addressed in your earlier, this thing is about the red flag signs. It's extremely important the parents need to know. The Ministry of Health has released the guidelines for children about the mild, moderate, and severe disease. And you have also, in your initial presentation, showed us that should be there and available online. And I'm sure the parents can download that. And the red flag signs are extremely important, to distinguish between a mild to moderate to a severe disease. And I would say that one of the things that parents need to address is that immediately, we are getting calls. If they have a fever, which is low grade or cough and cold, it's a very, very mild disease, and they should not get too worried, too stressed. Yes, they need to get them tested. But what we are seeing is that testing is not easy. Sometimes you're not able to get your turn in the next 1 or 2 days. That's also okay. So as soon as the possible they get tested, then obviously the isolation, the doctor has said, yes, it's extremely difficult for children to separate. I had a case where the mother and father are positive and they have a 1-month-old child who's breastfeeding. You just can't isolate this child. Then they have another 3-year-old who doesn't want to get isolated. So in this situation, I told the parents to do all the COVID precautions, use the mask and other things, and keep the baby with them and continue caring the child the best they can. But very important, these parents who are living with young children need to see if they're having rapid breathing rates. For different ages, the child's respiratory rate varies. For example, if the child is young, say 2 months or less, any rate over 60 per minute, you could actually count it. If it is very worrisome, it's a red flag sign. In a child who's like between 2 months to 1 year, any respiratory rate more than 50, as has been shown in the Ministry of Health guidelines, is important. For a child who's, say, a little older, between 1 to 5, a rate over 40 we take as significant. So depending on the age, the respiratory rate is a very, very. The other is, if the child is not feeding, if the child is repeatedly vomiting, there's a risk this child is going to get dehydrated. And therefore, a very crude way is if the child is passing urine. And so that doesn't mean, so if the child is not passing urine, his child is repeatedly vomiting, this is a red flag sign. If the child gets drowsy, he gets lethargic, those are where if the child gets any convulsions, these are severe signs. They need to immediately rush to an emergency. Sometimes small children who get high fevers, they can get febrile convulsions. The fever can go into their head and they can get a seizure in which the eyes can roll over, they can get unconscious. So what we recommend is to continue giving paracetamol quickly and immediately to prevent. So if you keep the fever down, you're not going to get febrile. Febrile convulsions are very common between the ages of 6 months to 6 years of child. And we need to make sure that we, besides the paracetamol, if the fever is high, you can give tepid sponging or, bring the fever down, giving a bath to the child. These are important things. The issue is the stress of the parents. Many times they need to take care of themselves. Many parents are sick at that time. So what today as pediatricians, that what we are doing is mainly online consultations, because we know the children, and if supposing the child has any comorbidities, that is also a red flag sign. Supposing the child already has a very severe bronchial asthma, he has a severe lung disease, he's a premature child who's just come out of the ventilator, he has got congenital heart disease, juvenile diabetes, and so forth. So these are serious cases, and a pediatrician would know about this background and will need to take care of the comorbidities. So these are red flag signs, and I think one should not self-medicate.
And red flag signs is something very important that you've raised here. And Dr. Rajeev, what you've just spoken about right now is very important, usable information to parents who are watching us right now. Some of the red flag signs in which that would indicate to parents here that the time for online consultation is perhaps over. It's time now to physically take your child to a pediatric center here. Dr. Prashant Kumar, this is, of course, what parents need to do at home as much manageable here. But the next question is about what governments, respective governments, not just the central government, but state governments here as well, now need to do in upgrading infrastructure of existing pediatric hospitals, getting in new pediatric centers here as well, not just for COVID treatment, but for child care as well. Children who are in families where their primary caregivers are unable to attend to them.
Exactly. See, it is not just about caring at home. Now we have moved on to cases where we are seeing sicker cases. Now involvement of government is very, very important. Okay. So we discussed like earlier, we have very, very limited infrastructure for kids to take care of it. You highlighted some data as well. There are hardly any pediatric specialists who can actually handle this. Like we are discussing with the panelists in the we hardly have enough experience to deal with this, the pandemic, current going on pandemic. So I would say like now, most of the decisions are taken care by the government. They are releasing the guidelines and all. So involve the panel of expertise. Like you take example, for example, like, Indian Academy of Pediatricians, have the panelists come up with guidelines and have a structured upgradation of the care for the kids. We can't have the treatment in kids is a lot different from how you treat in an adult, where there is a lot of comorbidities that are adding on to the chances of getting into sicker is slightly high. So caring a pediatric is totally a different ball game. So you cannot just extrapolate everything into and fitting into a kid with a lesser dosage. So most of the times we might fail in doing or achieving the good care for the kids. So have a upgradation of the scales, the infrastructure, have a dedicated pediatric hospitals. Very important issue raised. It's not just about COVID, like one of the panelists was highlighting. It's about getting aggressiveness. If you see small babies less than 1 or 2 years, they are becoming so much of deprived from the social activity. They are not meeting kids. They are not playing. The rate of autism is high. The rate of speech delay is high. The rate of developmental issues are so high. We need to address all these things in a nutshell. It is not like just sicker cases and treating about that. So we need to really have a very concise guidelines. Right. Everybody highlighted red flag symptoms are very important. These are the only kids who require a further evaluation as well as hospital admission. Okay. Then the expertise should have a detailed list of things, what all the things which are common, which we need to do, not that, doing lot many CT scans and other things which are not very relevant for every child who requires a hospitalization. Not just that, like one scenario they are highlighting, mother and father needs isolation. So how is that possible for a 2-month, 1-month-old baby or even little infant? We can understand the stranger anxiety. If parents are isolated, how will the child is going to cope up with that situation?
So all these things we need to address. So we should have a involvement of the expertise in that particular field, have a collaboration with the government, upgrade the infrastructure, have a dedicated COVID centers for the kids, as well as not just treating the sicker kids for the COVID, as well as all the common pediatric related associations. Malnutrition is going up, lack of vaccination is happening.
All right. Dr. Kumar, that's a very important point that you raised, that this needs to be a whole separate, dedicated team here. Dr. Namit, in your view, a state COVID task force and a national COVID task force here now needs to form a whole new team that takes into account children issues, children COVID cases as well. We still don't have that.
Yes, that's true. But also we do need to realize that the system is stretched. It's stretched beyond its capacity. So to want separate pediatric centers might be asking too much. We would probably have to go graded. And as was pointed out just now, probably we need to start having some pediatric spaces within the adult COVID spaces. Maybe we need to start building those up. Not every place, not every city, not every town would have a pediatric specific center or the facilities to have a pediatric specific center at all the times. So maybe a better utilization of the facilities would be to generate and make pediatric specific spaces within the adult COVID areas and train people with established guidelines, established protocols to treat children with the standard protocols. And only the small percentage of children who would need more specialized care would probably need the care of a specialist intensivist or specialist pediatrician. That way we could probably have a more smoothened out and better utilization of all the services. But yes, we cannot ignore children. We know with the huge, massive surge of cases, there are going to be more and more children affected. So we have to think of them and think of them in totality, not in isolation.
Dr. Nagpal, what do you think should be India's learnings from other countries who've reported a rise in COVID cases in children? Of course, the virus does tend to behave differently in different geographical locations, in different times and different waves that we've seen here. But irrespective, what are the larger learnings that India can benefit from, that India should be taking into account right now?
One is that we know that the second wave is much more infectious in our country. We are seeing so many children getting infected. In fact, all of us, I'm sure that all the pediatricians here and everywhere else, from morning to night, we are dealing only with COVID patients. We have to learn two things from other countries. The first is contact tracing. We have not been able to do the right amount of contact tracing, what to say about children, but even in adults. At present, there is hardly any contact tracing. Second, the social system in many countries is much stronger than in our own country. I know of children who have lost one of their parents to dreaded disease, and the other parent is also sick, and the child is like an orphan, not being looked after. Our social security has to improve. Somebody has to look after that child. Those organizations have to be. Having said that, all this, I don't want to give a very sorry picture. In our country, I see, and it is my practical experience, people are saying that there are a lot of communities which are coming together to help other people, our neighbors, everyone else. Number two, our children, as most of the panelists here have said, they improve, they get better, and most of the children are okay. So if we take proper protection, if we educate our children well, we will be able to defeat this. I still have hope in our country and in our children that we will be able to beat this.
Children, of course, are far more conscientious in following instructions here, in taking instructions more seriously, of course. Yes, that is indeed well pointed out. That is the hope that we have from our children here. But Dr. Vinky, this is now with respect to post-COVID care, after recovery here. There is, of course, post-COVID care for adults already, which is now called the long COVID. But because we're dealing with a group, this is particularly 0 to 10 years of age, where the respiratory system, the digestive system is already very vulnerable. It is above 10 years that it begins to further strengthen. What should be the post-COVID care for children?
Yes, right. Before I mentioned about the post-COVID, I would like to mention one thing. As far as the pediatric setups of COVID centers are concerned, we know that there are all adult COVID centers which are there now. And pediatric patient, if needs admission, has to be admitted in the adult center, which is very difficult for a pediatric patient to get admitted over there. And what I feel is, because there is shortage of beds also as on today, one thing can be done, because this is an extraordinary situation. Now, in this scenario, the pediatricians in their hospital can have a separate ward, or they can have a separate few rooms for a COVID patients, because this is quite, the situation is, it's a need of an hour. We can have a separate room, we can have a separate staff for the COVID patients over there. So having a dedicated pediatric hospital, if it is not possible, we can have some part of hospital as a pediatric hospital in a pediatric setup. This can be done. Now, about the post, I think this, the most important is we all know that this is at this multi-system inflammatory disease which is seen in the children. So this is one thing which is very important. We are witnessing from the first wave itself, but now in the first wave, what we used to see that these patients were coming after they had a COVID around month or 1.5 or 2 months back. But now we are witnessing even 15 days, 10, 15 days, 20 days after also we are witnessing a children's having this multi-systemic involvement. This is a very severe condition. And in this condition, actually, we are seeing the heart is getting involved, the kidneys are getting involved, almost every part of the body is getting involved. So this is one thing which we need to keep in mind whenever we get a patient, because we have seen a patient coming with all symptoms like a Kawasaki disease. So this is one area in pediatric where we have to keep a watch on children, because these are the children who needs admission. These are the children who needs immunoglobulins, they need steroids, and they need the treatment actually. So these are the, we have already mentioned that most of the children are asymptomatic. They don't need hospitalization, but these are the children who actually need hospitalization.
Okay. We were talking about what learnings we could have from other countries on what has been reported outside here. Let's play out on the observations that have been made. This is with respect to cases that have been reported and seen in other countries. In the United States here, it has now in fact been established that children account for 22% of cases. Israel, though, claims that children up to the age of 9 will not spread the virus. Now, this is something that the world across we were following for the first wave, but India is facing a very different scenario here in the second wave. United Kingdom says 13% of children aged 2 to 11 have shown COVID symptoms, have suffered from COVID. And then there is Italy, which says over 200 children infected, and this is through household transmission. Dr. Rajeev, in your view, as far as India's learnings, I'm repeating this question here again because we need to kind of weigh in here on this. How similar are going to be India's learnings or the takeaways here from what has been reported from other countries here? Because we are also looking at our second wave, which has a much more heavy viral load. much more number of cases. So we are perhaps going to be dealing with much more percentage of COVID children cases here as well. And we are already beginning to establish that children, irrespective of their age, it's not just a marker up to 10 years of age. Children of 0 to 17 can be silent carriers as well. They're capable of transmitting it.
Absolutely. See, the data which came out in the first wave of COVID by the ICMR, Director General, Ministry of Health, the ICMR, children under 17, they reported about 8% of the total active cases happened in children. And 70 to 80% of these were asymptomatic. And we believe that they were super spreaders at that point of time. But given our experience, limited experience, I would say, of COVID phase 2, which is very infectious, and we are seeing lots of families being, even if a child gets mild fever or moderate, I mean, the fever is fever, and a child just shakes the parents, and they get very worried and concerned. And given the experience that I've had with pediatrics, I would say that I'm practicing in Delhi, and children are not just in Delhi. If you go just 70 kilometers outside of Delhi into the rural areas, you won't find a pediatrician there. I run a small non-profit organization which works in Mewat in Haryana, which is an aspirational district of India, more than 12 lakh population, 40% are children. There are just no pediatricians. Only the government has hired 2 pediatricians in that for a population of 11 lakhs. So the question is that we need to empower our frontline health workers in these situations. You see, we need to talk about rural marginalized populations as well. And there the ASHA workers are the backbone of the national health systems. The Anganwadi workers look after children less than 6 years. So these two are the backbones, and we need to take help. These guidelines which have come out from the Ministry of Health are awesome. They should be given to them as well, and they need to be empowered. So online, we have been engaged in training our ASHA and the health workers in addressing COVID in children. It is not going to be possible that you're going to get a pediatrician everywhere to deal with child with COVID. The child with COVID needs special care and assurance, especially for the parents. And parents are very worried. They themselves sick and the child is also sick. That becomes a very big problem. What we need to assure, and we have said repeatedly, that COVID in children is usually at least 95% of the COVID are just mild cases, and they will resolve. The few of them will get into moderate symptoms. And those moderate symptoms and the severe symptoms, the red flag signs, we will say that again, if your child gets extremely high fever, he's just drowsy, gets convulsion, if the child has rapid breathing, is not feeding, is repeatedly vomiting, or has severe pain, irritability of an extent that is not being managed, you need to go to an emergency center. But wherever you are, you need to network with your health providers. A lot of our family doctors, MBBS doctors are managing children in the level 2 or 3 cities as well. And if they are watching, those parents need to be assured that your child is not going to get these 1 to 2%, those multi-system. Why talk of the worst? We don't, at this time of the pandemic, it is very hard to get extra manpower for children. Also getting infrastructure like a COVID centers for children. They, like Dr. Vicky has said, they will be managed in natural COVID centers.
Right.
Maybe you can designate a small space, and the nurses and workers who are specially trained in handling
so
children.
let me take your point across here to Dr. Namit, who's of course with the Indraprasth Apollo Hospital here in New Delhi. Dr. Namit, what are the challenges that you foresee, if not already facing, as far as COVID children cases are concerned. We were aware that Dr. Apollo, that the Apollo Hospital here, of course, also extremely overwhelmed, overburdened already by the existing adult cases here. But as far as your pediatric center is concerned, your specialized center here is concerned, what are the challenges and what would you expect from the government?
So the challenges for the patients who are admitted and the pediatric patients who are admitted is essentially having an area and the staffing which is appropriate for the child. So we have managed to have an area within the adult COVID areas. When I say adult COVID areas, it's an area which has a separate entry and exit with proper donning and doffing of PPE equipment and all that stuff. So we have an area which is demarcated for children as much as possible. But the real challenge happens with younger children, where you would imagine and you would want a caregiver to be with them. And if you have, say, a 2-month-old or a 6-month-old child, you obviously cannot have only one caregiver with the child for 24 hours or every day. That caregiver also needs to go out, come back in, and maybe some other caregiver comes in. So the parents or grandparents, and that becomes a huge challenge to maintain the sanctity of the protective practices, the prevention practices, the PPE equipments and all. So that becomes a huge challenge. And we try to minimize the number of visitors. We tend to have only 1 or 2 caregivers who keep rotating between them for these patients. And I think this becomes a huge challenge for us to maintain children in these isolation wards, wards which are sort of in the midst of a very strange environment for the children. And they're, as it is, the parents, children, everyone is very anxious, and they're in a very foreign sort of territory where they are not very happy. Everyone is concerned. So I think that is the biggest challenge of having an area which is child friendly, and then to have staffing which is trained for children to look after children. Again, most of the beds are occupied by adult patients because they're overwhelmed with adult patients. But we do need to have some space for children with specific expertise for them as well within those areas.
Dr. Rahul, very quickly, I'll leave the final remark here before we wrap up on this discussion. Do you think that there needs to be more clarity, or even in the form of an instruction that should now come in from the government here in telling government as well as private hospitals and centers here to start preparing for this specialized area?
I think the government and the private sector are doing their bit. The government has already listed their protocols and what to be done. I'm sure they will look towards making special dedicated children's hospital. Within the private hospitals, as Dr. Jareth clearly said, that we have to have our own isolated places within our adult COVID patients. There is no other way. The biggest challenge is the staffing. It's so difficult. And as Dr. Jareth clearly said, that it is very difficult to maintain children without their parents. So you have to get them in. So we have to create, and I believe that after some time, we will see more and more children who would require admission, because MISC, even if it is 1 to 2%, the amount of children, the number of children who have been affected, we will have more patients coming in. And we will have to create our own spaces. In my own hospital, we are already talking to the administrators to get specialized areas for these children. The government, I'm sure, will do its job. They should be made. They are already aware that they have taken out the statistics that 80,000 children, as per you yourself mentioned right in the beginning, and that was only till April 3rd.
Yes,
have been
more than 79,000. That's right.
It should take only 1%.
We're hoping sooner than expected that the government comes in with more clear instructions here as well in addressing infrastructure for pediatrics. That's much more important. This cannot be handled entirely at home. But we appreciate all the doctors who've been with us here tonight. There were a lot of anxious parents, I'm sure, who have been watching this show tonight, and hopefully we've managed to allay certain fears. hopefully answer a lot of your questions here as well, and a lot more for all of us to work in this together for our children, for our future generation here, while we pull through this extreme crisis of the second wave here. Also manage well in dealing with the stress that our children are facing as well, both physically as well as mentally. It's been an informed 1-hour discussion here on this, but we want the government to be talking about this more often, more loudly, and with more emphasis, raising the alarms as and when we're looking at an increase in numbers. Remember, the data that we have is up to the 4th of April. A lot of time, a lot of drastic changes on ground that we have seen since the 4th of April. We need more data. We need more studies basis which every person, every authority involved in the health sector can act well in time for our children. Thanks for being with us tonight.